This is a summary of the CPIC guideline for serotonin reuptake inhibitors and variation in the genes CYP2D6, CYP2C19, CYP2B6, HTR2A, and SLC6A4. This video will specifically discuss the recommendations for paroxetine. Videos covering the recommendations for citalopram, escitalopram, fluvoxamine, sertraline, venlafaxine, and vortioxetine can be found on the PharmGKB website and on the PharmGKB YouTube channel. This guideline was last updated in July 2023. Patients who are CYP2D6 ultra-rapid metabolizers may be less likely to respond to paroxetine, while CYP2D6 intermediate or poor metabolizers may have an increased probability of side effects. As a result, the guideline recommends that an alternative drug be selected for CYP2D6 ultra-rapid metabolizers and that a reduced dose and slower titration schedule be considered for CYP2D6 intermediate or poor metabolizers. This image is adapted from the PharmGKB paroxetine pathway. A link to the original pathway is provided in the description below this video. Paroxetine is inactivated by metabolism by CYP2D6. In CYP2D6 ultra-rapid metabolizers, the metabolism of paroxetine is increased. This leads to lower plasma concentrations of paroxetine. In CYP2D6 poor metabolizers, the metabolism of paroxetine is reduced. This increases plasma concentrations of paroxetine and may increase the patient's risk of adverse effects. There are over 170 different CYP2D6 alleles, which are designated as star alleles. Each star allele can be assigned an activity value based on its activity level compared to the star 1 allele. The star 1 allele has an activity value of 1. This table gives the activity values of some CYP2D6 star alleles. It is based on the CYP2D6 allele functionality table, which can be found on the PharmGKB and CPIC websites. Links are given in the description below this video. It is strongly recommended that you consult the full allele functionality table as it gives further examples of alleles with their activity values. In addition, the supplementary material for the guideline provides more information on interpreting CYP2D6 genetic test results, as well as limitations and caveats that should be considered. Be aware that some CYP2D6 alleles have an unknown or uncertain functional status and should be interpreted with caution on a genetic test. In addition, an important caveat for all genotyping tests is that any alleles which are not detected in the assay are designated as star 1. This can include rare increased function, decreased function, and no function alleles, which are not routinely screened for in some genotyping tests. It is also important to note that patients can carry multiple copies of CYP2D6. Reports in the scientific literature have described cases where up to 13 copies of CYP2D6 were present in a patient's genome. Alleles which are present in multiple copies are shown using an X, then the number of copies of that allele that are present in a genome. For example, a patient with the genotype star2X3 star4 has 3 copies of the star2 allele and 1 copy of the star4 allele. The activity value of alleles that are present in multiple copies is calculated by multiplying the activity value for the allele by the number of copies present. In this case, the activity value of star2x3 is 1 multiplied by 3, which equals 3. Further information about CYP2D6 alleles can be found at the PharmVar website at www.pharmvar.org. A link to PharmVar is also given in the description below this video. The activity values of a patient's CYP2D6 alleles can be added together to give a total CYP2D6 activity score for the patient. The CYP2D6 activity score is then used to assign a CYP2D6 metabolizer phenotype to the patient. Note that genetic tests from different laboratories may not use this scheme to assign CYP2D6 metabolizer phenotypes. Because of this, the guideline advises that a patient's CYP2D6 diplotype is noted and activity score calculated before making clinical decisions based on this guideline. These are the CPIC recommendations for paroxetine. Patients with a CYP2D6 ultra-rapid metabolizer phenotype will have increased metabolism of paroxetine compared to normal metabolizers and may be less likely to experience a clinical benefit of paroxetine. An alternative drug that is not predominantly metabolized by CYP2D6 should be chosen for these patients. This is a moderate recommendation. Patients with a CYP2D6 normal metabolizer phenotype will have normal metabolism of paroxetine. These patients can begin paroxetine therapy with the recommended starting dose. This is a strong recommendation. Patients with a CYP2D6 intermediate metabolizer phenotype will have reduced metabolism of paroxetine compared to normal metabolizers, which may increase the probability of side effects. A lower starting dose and slower titration schedule should be considered for these patients. This is a moderate recommendation. Drug-drug interactions and other patient characteristics should be considered when adjusting dose or selecting an alternative therapy. Patients with a CYP2D6 poor metabolizer phenotype will have greatly reduced metabolism of paroxetine compared to normal metabolizers and may also have an increased probability of experiencing adverse effects. A 50% reduction in the recommended starting dose, a slower titration schedule, and a 50% lower maintenance dose should be considered for these patients. This is an optional recommendation. Drug-drug interactions and other patient characteristics should be considered when adjusting dose or selecting an alternative therapy. There is no recommendation for patients with a CYP2D6 indeterminate phenotype. The recommendations for paroxetine can be found in Table 2 of the guideline. This guideline has been annotated on the PharmGKB website. This includes a drop-down menu where a specific recommendation can be given for given combinations of alleles. This includes implications for the patient's response to paroxetine, the appropriate recommendation for the specific metabolizer phenotype, and the strength of that recommendation. Remember that variation in other genes in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC's guideline or for any errors or omissions. The guideline itself and supplementary information are freely available at the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.